Hello everybody, my name is Molly Dowd and I'm one of the district nurses with Walnut Creek School District. Kathy Shalin and I have prepared this presentation for you today. So the objectives of this presentation are to discuss the protocols and procedures we have put into place to make sure the reopening of schools goes on smoothly and safely. Today we're going to be going over the Return to Learn 3.0 website, the COVID-19 dashboard, the COVID-19 home self-screening tool, face coverings, physical distancing, hand washing, cleaning and disinfecting, health room procedure, contact tracing, staff COVID-19 testing, mental health, and health conditions. So we wanted to start off with the definition of COVID-19 because even though it's been going on for a while now, it's still very important. So COVID-19 is an illness caused by a virus that can spread from person to person through respiratory droplets. The virus that causes COVID-19 is a new kind of coronavirus. There's actually a lot of types of coronaviruses, but this is a novel virus that has spread globally. And COVID-19 actually stands for Coronavirus 2019. So this is the Return to Learn 3.0 website. If you go to the Health and Safety tab on the website, this is where you'll get all of this information, and everything in this presentation is included on the website, so that's where you can find it. The Walnut Creek School District COVID-19 dashboard. So this is where available on the Return to Learn 3.0 website, and it's where we can show you the total confirmed positive COVID-19 cases that we've had so far. So Walnut Creek School District does not count community-related cases for individuals who did not come onto campus or within close contact of other students and staff. So this only includes positive individuals who have been on campus and within what's considered close contact of others. So close contact is defined as being within 6 feet of somebody for 15 minutes or longer within a 24-hour period. So prior to arriving onto campus, you will perform a home screening for a student. Students must stay home if they exhibit one or more symptoms of COVID-19, and it is best that you notify the attendance office if this is the case. We are counting on your honesty to keep our school environment safe for staff and students, so it's really important that if your student is having symptoms that they stay home. So this is the home health screening tool that you'll be using to screen your student before coming to school. You won't actually have to submit anything, but it's something for you to read over to make sure they're not having any of the symptoms, that they haven't been exposed to someone who is a confirmed positive COVID-19 diagnosis, and also the next steps to move forward. So we wanted to provide you with some COVID-19 testing information. So if for some reason you are not able to get a test done through your primary care provider, the county also does provide their own testing. So Contra Costa Health Services has free drive-in COVID-19 testing for residents with symptoms of fever, cough, shortness of breath, or fatigue. And they have a couple of different locations, so you can do whichever one is more convenient for you, and you can go to their website if you want to make an appointment. Sometimes we have found that they can get you in a little bit faster for testing, so this is definitely a resource to take advantage of. So getting your flu shot is still very important, even though it is later in the season. There's sometimes a second wave of the flu in March, and we really want to mitigate the risk of this, especially with COVID-19 going on. So there are several different clinics that can give the flu shot within Contra Costa County. And if you are a Kaiser member, the Dublin Medical Office and the Martinez Medical Office do have a drive-up flu shot clinic as well. So you can use these to get your flu shot. Face coverings. So face coverings are going to be required by all staff and students, and it is best to handle the mask by the loops, and it's important that you make sure that your child's mask can cover their nose and their mouth. All masks that are visibly soiled, have holes, or don't fit should be replaced, and the masks should be stored in a clean place where they won't get dirty. It's important to clean hands before handling the mask, and laundering the mask each day after use in warm water is also good. So this is just a graphic the World Health Organization put into place, and it kind of just gives you some reminders on the best mask procedures. So physical distancing will be enforced while at school. Chairs and desks are going to be situated 6 feet apart, and any group activities need to be completed while maintaining physical distancing. A contact of a positive COVID-19 case is defined as someone who is within 6 feet of you for longer than 15 consecutive minutes within a 24-hour period. So what does a typical class look like? As you can see, the desks will be situated 6 feet apart. On all desks will have plexiglass on them, and students will be organized into what's considered stable groups. So this means smaller class sizes and less risk of exposure and COVID-19 being spread through the school. Hand washing. So students are encouraged to wash their hands and use hand sanitizer as much as possible, but especially after touching high contact surfaces. So basically a high contact surface is any surface that is being touched by multiple people throughout the day and could allow the spread of germs. So this could include doorknobs or light switches, for example. And students will always be cleaning their hands before and after eating, after using the restroom, after coming to the classroom from outside, and teachers are going to supervise and encourage this. Hand washing stations will also be available throughout campus, and students will be encouraged to use consistent hand hygiene through this as well. So it's important to wash your hands with soap and water for at least 20 seconds, and one way to remember this is by singing the happy birthday song twice. That's around 20 seconds long. And it's also important to make sure that you're lathering the soap in between those fingers and under the fingernails, as sometimes dirt and germs like to hide under that as well. Cleaning and disinfecting. So teachers will have access to a designated spray bottle with cleaning solution for as-needed spot cleaning, but disinfection will also occur between stable groups and as needed by trained maintenance staff. Highly touched surfaces will also be disinfected throughout the day, and this again includes the door handles, desks, phones, light switches, and faucets. So if you look on the upper right-hand screen, you can see all of the checklists for the maintenance staff. So this includes a classroom checklist, multi-purpose room checklist, the restroom, and the outdoor area. So it kind of just shows you the thorough cleaning that is going on a daily basis by our maintenance staff. And then on the bottom right-hand corner, you can see the disinfectant that we're using the most. So it's the 730 HP disinfectant cleaner. And the active ingredient for this cleaner is hydrogen peroxide. And after 1 minute on a surface, it kills COVID-19. So it's also approved by the EPA. So that's kind of what we will be using mainly to disinfect. All right, the health room procedure. So students will be assessed for COVID symptoms. If COVID symptoms are present, staff will call parents for pickup within 45 minutes. If you are for some reason unable to come pick up your student within 45 minutes, you should designate somebody who can. So, and then parents will be encouraged to get their student tested if they are symptomatic. And if they aren't tested, then the students have to stay out of school for 10 days and continuing to monitor their symptoms for 14 days. If the student tests positive, they will stay out of school for 10 days, and then the district nurses will conduct contact tracing. And all individuals who come into direct contact with the positive individual will have to stay out of school for 10 days, and we will be notifying everybody about that and like the different steps to move forward. So this is the health room send home letter. So this is what will be sent home with your child if they are sent home from school symptomatic. It kind of, again, just goes through the instructions of encouraging you to get your student tested, and then the steps that will need to be taken if they test positive or negative and how to move forward. Contact tracing. So when a positive case is identified within the Walnut Creek School District, we will conduct our own contact tracing to identify anyone who is considered a contact. So you will be notified if your student has been identified as a contact of a positive case, and they will be required to quarantine for 10 days and monitor symptoms for 14 days. So this is a bit of an update. It used to be that the quarantine period was 14 days, but now it has been lowered down to 10 days while monitoring symptoms for 14 days. Testing is also recommended, although even with a negative test, if you are a contact of a positive case, you still have to stay out of school for 10 days, if your student is, they will have to stay out of school for 10 days because there is a possibility that they will become contagious within that 10-day period after they made contact with that person. So if they do become symptomatic, however, that could be a sign that they're developing COVID symptoms, so it's important that you contact your healthcare provider and possibly get a test. We will communicate all positive cases to Contra Costa Health Services Department, and they will be conducting their own contact tracing within their department. Our contact tracing will mainly be within the Walnut Creek School District community, while the Contra Costa County Health Services Department will do more community-related contact tracing out into the county. All right, so this is the exposed student letter. So you will receive this letter if your student has been identified as a contact of a positive COVID-19 case. It explains the different symptoms of a COVID-19 to look out for, and basically the next steps in the quarantine period and everything that you will need. So we did also want to let you know that we are doing staff surveillance testing, and currently we are using a vendor known as Curative. So this helps us identify positive cases of asymptomatic staff members, which will allow us to do contact tracing and quarantine exposed individuals. If your student's teacher is identified as COVID-19 positive through this surveillance testing, it is likely your student could be identified as a contact and therefore will have to quarantine for 10 days. And again, we'll send that letter out to you and notify you of this. So we wanted to end this presentation just talking a little bit about wellness, because this is obviously a very crazy time where a lot of anxiety and stress are associated. So there are different things that we wanted to discuss. And the first thing was Zoom fatigue. So we all are feeling it. Zoom makes communication more difficult and causes an unconscious overworking of the brain. But there are some helpful tips to help reduce Zoom fatigue. So being mindful of the environment where your child participates in their Zoom sessions, establishing a routine and making sure to stick with it, scheduling movement and sensory breaks, and also making a sensory toolbox to use during Zoom sessions. So that could include something even as simple as like a fidget spinner for them to use. And then going outside and going for a walk, a hike, or a bike ride is great. Making sure to use those large skeletal muscles and get some blood flow going is very important after sitting on the computer all day. So screen time and vision. Increased screen time can cause eye fatigue and lead to other vision issues. So there are practices that you can do with your child to make sure that they have developed good eye habits. So using the 20-20-20 rule has been very important during this time. So basically that just means that every 20 minutes looking away from the screen for 20 seconds and focusing on something that's around 20 feet away. So this is just something very simple you can do that isn't very time consuming and can really help you with your vision. Also adjusting the lighting to eliminate glare on the screen, whether the glare is coming from a light in your house or your living space, or if it's coming from the sun outside, making sure there isn't any glare on your screen is pretty important. And also having your child spend some time outdoors when possible. Exposure to that natural light is very critical to developing eyes. So nutrition. So healthful eating habits has a lot of benefits for children. It can stabilize energy, improve cognitive function, even out moods, help maintain a healthy weight, help prevent chronic disease, and also prevents mental health conditions as well. So you can go to a website called MyPlate to kind of see what should be included in a well-balanced meal for your child, and really focusing on that is very important to basically all aspects of health. So getting exercise is more important than ever during COVID-19. It has not only just physical health benefits, but also mental health and cognitive benefits. So the CDC recommends 60 minutes of exercise a day, which I realize can sound very daunting. It seems like a long time, but there's little things that you can do and incorporate into your daily routine that can make those minutes add up really fast. So exercise that increases heart rate is important. So that could be running, biking, hiking, dancing, or even something silly like balloon volleyball. Building muscle is also important. So that's kind of like the strength training, which could be climbing or push-ups, and then strengthening bones. And also, this also will help joints, is doing stuff like jumping rope or gymnastics. So just incorporating these throughout the day, you would be surprised how fast that could add up to 60 minutes, and it really has a lot of benefits. So sleep is also very important for health and school performance. It can affect your child's mood, their motivation, what they're eating, how much they're eating, how often they're interacting with their family, and their relationships with their family and their friends. Sleep deprivation does have various significant impacts on mental health, so that's just something to note. So recommended sleep, 10 to 13 hours of sleep are recommended for ages 3 to 5, 9 to 12 hours for ages 9 to 12, and 8 to 10 hours of sleep for ages 13 to 18. So some tips to help maintain that sleep is to establish a routine, to stick to a bedtime, avoiding screens, especially right before bed, and creating a good sleep environment. So there is a COVID-19 support group through the Contra Costa Crisis Center, and this support group includes topics like understanding stressors, coping strategies, strength in sharing, and COVID and grief, and even embracing humor. So this is a great resource if you are going through a rough time right now. And also the the Contra Costa Crisis Center does have a phone line and a text line if you just want to talk to somebody about really anything at all. So this is definitely a great resource to take advantage of. So lastly, Kathleen and I wanted to talk about health conditions as just a reminder. So things have obviously been a little bit wonky this year with COVID-19 and being in distance learning, but it is still incredibly important that if you have a student with a health condition that you complete the required documentation so that we know what health condition that they have while on campus and what that we can provide for them. So please contact either your office manager at your school site or the district nurses, Kathy and I, if you have a student with a health condition that may require any accommodations or medication while on campus. Once this documentation that we will need is submitted, you can drop off your students' medications to the office because office managers are there to accept them. So if you have any questions or anything at all, that concludes our presentation. Kathy and I are available, and we would love to answer any questions that you have. So please take advantage of our contact information. So we included our emails and our phone numbers as well. All right, well, thank you so much for listening to this presentation.